Hi, so it's with great pleasure I get to introduce Kari Kretch today. She is an assistant professor of research in the division. She's been here for a little while, but as a DPT student, and then has come on as a postdoc, and then transitioned over to assistant professor of research approximately a year ago. And so she works in the motor development lab. And one of the major accomplishments that I want to highlight for her is that she had a commentary article accepted for publication in Pediatric Physical Therapy, discussing the implications of an updated CDC developmental milestones for physical therapists. Congratulations on that accepted article, Kari, and please take it away.
All right, great. Everyone's seeing my slides okay? Looks normal, okay. All right, thank you so much. There we go. So my research background is actually in developmental psychology. So I am a physical therapist and a developmental psychologist. And the goals of my research, I think, reflect this interdisciplinary perspective. And those are first to understand the role of motor skill and everyday motor experience in shaping global developmental trajectories. And this is in typically developing infants and infants with motor delays. As well as to use this interdisciplinary lens to inform PT interventions that promote exploration, learning, and global development in infants with motor delays and disabilities. So my methods come mostly from psychology. I use lots of video observation of natural behavior. I use head-mounted eye tracking to measure visual exploration and visual attention in the natural environment. And I use ecological momentary assessment to measure behavior throughout infants' day to find out what happens when they're not in the clinic or in the lab. One line of work has focused on relations between perception and action in infant locomotion. So in particular, I have studied how infants gather and use perceptual information to plan locomotion and how this changes with crawling and walking experience. And in another line of work, I looked at how real-time and developmental changes in infants' posture or body position, so for example, the transition from crawling to walking, affects what infants see and how they interact with their caregivers. More recently, I've started to expand this work to look at some of the same issues in infants with significant motor delay due to neuromotor disorders like cerebral palsy. So this work has sparked my interest in what are known as developmental cascades. And so this is a framework that's informing a lot of my current research. A developmental cascade is a causal relationship between one developmental change and then another developmental change, with the second often in a completely different developmental domain from the first, that is mediated through effects on daily experience that change opportunities for learning. So for example, attainment of a new postural skill, such as independent sitting, increases everyday sitting experience, which increases exposure to certain learning opportunities that are facilitated in a sitting position. So these are things like having a better vantage point to view caregivers' faces, or increased capacity for manual exploration of objects. And then this process results in other developmental advancements. So independent sitting, specifically has been linked to improvements in cognitive and language development. And as a physical therapist, my ultimate goal is to look at how these cascades play out in children with physical disabilities and motor delays. In one study, we found that actually this very first link in the cascade may be disrupted. We found that the relationship between sitting skill or capacity and sitting performance actually differs between infants with typical development and infants with neuromotor disorders. So even at similar levels of sitting skill, infants with neuromotor disorders do not spend as much time sitting during play. We are currently trying to learn more about what this everyday experience is like for infants who go on to be diagnosed with cerebral palsy and how much it differs from that of their typically developing peers. And so these are the ecological momentary assessment studies that I referenced earlier, where we have caregivers reporting throughout their day on their infants' activities. And we are continuing to explore how posture affects learning opportunities for infants with motor delay. So we're looking at how placing infants in different postural contexts affects their ability to manipulate objects and interact with caregivers. The ultimate goal of this work is to determine how to harness this cascade process to support global development in infants with motor delays. So if we know that sitting is delayed or different or even sometimes absent in children with disabilities, we need to intervene to get these developmental cascades back on track. One intervention strategy would be to focus on training sitting skill to initiate the cascade. And this is sort of the typical focus of pediatric physical therapy. The second option is to increase sitting experience using compensatory interventions like seating or positioning equipment. But of course, the problem is that these intervention strategies can conflict. So overusing seating equipment may impede infants' ability to practice postural control and improve their skill, but waiting until infants can sit on their own may limit access to important developmental experiences and learning opportunities. So here is my next step. I'm really excited to start piloting the use of a body weight support system to help infants maintain a sitting position while still allowing them freedom of movement and exploration. And the goal here is to promote practice of upright postural control while also providing the developmental benefits of large doses of sitting experience in the home environment. This unit is portable and can go into the home. So stay tuned, and I'm excited to update you all on where this goes in the next couple of years. And feel free to reach out if you're interested in learning more, or if you have a baby scientist you'd like to volunteer for one of our studies.